You prescribe GLP-1s?
I do, yeah. So actually, you had asked me about that before, and I took some notes on that. So my position on the GLP-1s, I think they have a role. Um, Borderline diabetic, people who are chronically obese. Zepbound just got approval for sleep apnea, right? Like, it's not rocket science. You lose weight. You get somebody who has a BMI of 40, you get their BMI down to 32, they may not have sleep apnea
Some
as
things are
much.
going to get better.
Yeah.
Maybe they don't need gastric bypass surgery.
Right.
I've actually been, I was an early adapter to the GLP-1s, and I agree with them, particularly for diabetes management. Now, they've gone and gotten other indications, like some of them, Ozempic has a cardiovascular risk reduction indication.
We've seen both sides of the coin in here. We've seen people who it's really kind of kickstarted and sparked a lot of change in their life. Like it helped them lose some weight, and they had confidence to come in here more and work out and make dietary changes and go skiing more and do other activity. And yeah, their sleep's improved, their whole life's improved. Their life is probably going to be longer and better quality now because it sparked these things. But we've also had a couple people who, I don't know exactly the mechanism, maybe you can speak on it, whose gut like slowed down so much that they ended up.
So let me just go backwards real quick to the cardiovascular risk reduction. Ozempic, the trizone, right? What is it? Weight loss, glucose management, and cardiovascular risk reduction. Now they just got an indication for CKD, which is chronic kidney disease. But again, you lose weight, your blood pressure goes down, all these things get better.
Right.
Shocker.
The risk, or not the risk, I think it's a patient to treat ratio. So you have to treat almost 600 patients with semaglutide to decrease one cardiovascular event. So now let's talk about the side effects of pancreatitis, the constipation, all the other problems. The one that, is legitimate is pancreatitis, man. I mean, that stuff works directly off of your pancreas. That's how one of the ways it works. And this is what gets me about these GLP-1s. A lot of these, the boutique pharmacies and the third-party pharmacies.
Is that like the Hims Hers? Is that what that is?
That's some of them, but they're like everywhere now, right? So, and I even had colleagues who I know didn't have this conversation with people. There's a black box warning for the GLP-1s, and it's for personal history of pancreatitis, family history. There's a note about medullary thyroid carcinoma, which the drug was, the drugs have been studied in rodents. Rodents are more predisposed to medullary thyroid carcinoma. People rarely get medullary thyroid. They get papillary thyroid carcinomas, but not medullary thyroids. So it's like a different, that one I worry less about, but I don't think the Hims and the Hers and all these boutique pharmacies and a lot of these providers that work for these huge systems, again, you have 15 minutes. How did you address my blood pressure, my depression, and I left with a script, for semaglutide.
Right.
Those, to me, that's important to have those conversations. Like, yeah, this stuff will help you lose weight, but it's not bulletproof. Anecdotally, we've seen, some increase in gallbladder problems. Again, anecdotally, absolutely GI motility issues. There are issues.
So it's you just making a decision,
A clinical decision, right? And again, what kind of irks me about them is, yeah, absolutely. Somebody who has a BMI of 35 and family history of type 2 diabetes and coronary artery disease, and they're destined for problems. Great candidate. Somebody who has a BMI of 28, who's 40 years old, who wants to get back to their bathing suit body, like,
right.
Sorry, bro.
Yeah.